And welcome back to Roy on Rescue. I got an email in regards to a question that is kind of a piggyback off from another episode I did in regards to chest wounds and CPR. And the question came back, what if there's two rescuers? Couldn't one rescuer hold direct pressure on the chest wound while the other person does CPR? And the answer to that is absolutely yes. I mean, when we have multiple rescuers, really everything changes. I mean, we have lots of hands to do stuff. So, you know, in the past, I've talked a lot about prioritization of treatment. What things should we do first? What things should we do second? You know, but many times that's because there's only one person around. You're bicycling, you're jogging, you're out in the park, you're driving. There's no other assistance around, and you come across a victim. What do you do when you're all alone? And that's kind of the worst case scenario. But it's always nice to plan on a worst case scenario and hope for the best. In this case, if we have second rescuer, third rescuer, we can do lots of different things. Whether that's spinal cord movement minimization by helping to stabilize the head while we're doing other treatments. If that's holding direct pressure on a hemorrhage while we're doing CPR. Of course, all of those things are great, and they would always be recommended. So, yes, the short answer to that is yes, you can hold direct pressure on the chest unless we're actually in the way of doing cardiac compressions. The other thing that might get in the way, of course, is an impaled object, and so we just do the best we can with the situation at hand. And, if the chest wound is so close to the center of the chest where we place our hands to do cardiac compressions, you're kind of doing both things at the same time. Then the other person wouldn't have to complicate matters by holding direct pressure. If it's somewhere else, like an abdominal wound or a side of the chest, like a stab wound, if it's on the back of the patient, we usually put a 4x4 bandage or a trauma bandage over the wound, absorb it, and then you kind of roll the patient up to be able to put the bandage underneath, roll them back down, and then start your compressions because that weight of the patient is helping to hold pressure. Now, we're not going to get into sucking chest wounds in this particular response. That's more of somewhat of a whole different matter that needs to be talked about. It's not really taught per the national guidelines for basic first aid and CPR. It's more of an advanced first aid or even a combat medicine, and then it gets into EMTs, paramedics, and so on. But there's things we can talk about with that too. If you have any interest in talking more about sucking chest wounds and how to treat those, I'd be happy to talk about that as well. I hope this helps. Thanks for the questions. Keep them coming. And until next time, keep on rescuing. Bye-bye.